live. Well, Medicare open enrollment for ages 65 and older is underway. And Dr. Kristi Clark, Medical Director for HealthTexas, joins us today to answer some questions that many of us may have. Thank you so much for being here.
Thanks for having me back. Good
I
to
know
see you.
this is something that a lot of folks probably do want to know about and have questions about. And this is an important time of year. And today we're giving folks the opportunity to address their concerns on this topic. So let's take a look at the first question, because this came to us on social media on Twitter. What is the annual enrollment period? What is annual enrollment?
So you're right, Fiona. A lot of people are very nervous around this time of year. A lot of patients with Medicare, this is the time that they're getting all kinds of phone calls, et cetera. So annual enrollment period, sometimes it's called an annual election period, is the time in which a Medicare beneficiary can change their plan or enroll in different additional benefits on their plan. The important thing to remember is that there's a lot of options out there. You know, my husband says that I can relate anything to shopping, anything and everything. And it goes the same with the Medicare enrollment. So your annual enrollment period is really a period of time when a person can kind of shop their Medicare benefits. They can go out and shop the benefits. And even though it's overwhelming, you got to remember that as we have more and more options in the San Antonio marketplace, that our seniors and other Medicare recipients have a lot more choices of how they can spend their Medicare dollar and how they can get the best plan for their particular needs.
All right, so our next question comes to us from Facebook, and it is, when is the annual enrollment period?
Sure. So when is the annual enrollment period? It is next week. It starts next Monday. So basically every year from October 15th until December 7th, Medicare recipients are going to have a chance to kind of shop their benefits like we talked about. I guess to take the shopping analogy one further, it's not really like a sale because there's not necessarily a change in the price or a discount, although someone could get penalties if they don't make decisions timely. It's more of like a special collection. It's when a person can look at a special collection that's only sold maybe once a year or so. So that's really more of the way. So next Monday, October 15th until December 7th.
So it's like something seasonal.
Exactly, seasonal, like a seasonal collection. Seasonal. Very good.
And October 15th is kind of like that second tax deadline, right?
There you go.
So remember that. Okay, and now we have a question from one of our audience members. This comes from Tori.
Hi, thanks so much for being here today.
Hi, Tori.
So I'm actually helping my grandmother enroll this year, and the question that I have is, what can a Medicare recipient shop for during enrollment?
Sure, it's a great question. We all want to know what we can actually get when we get out there to the marketplace. So there's a lot of different add-ons, if you will, that folks will be looking for during this time frame. Some people are looking for maybe a dental benefit, maybe they're changing pharmacy benefits, maybe they're looking for what's called a Medigap policy that would help cover some of the costs they have that Medicare doesn't cover. But the vast majority of folks who are out there in the marketplace are looking for what's called a Medicare Advantage plan. This is like that special collection we talked about that's open for this short period of time. A Medicare Advantage plan, again, shopping, is kind of like a fully coordinated outfit. You got the jacket, you got the shirt, the pants, the shoes, the belt, all goes together. So it takes a lot of the guesswork out of choosing little bits of each Medicare plan, like the right pharmacy program, et cetera. So a lot of patients like that. About 25 to 30% of current Medicare recipients will choose a Medicare Advantage plan, if you will. And then a second reason that a lot of folks are out there looking for a Medicare Advantage plan is many times these plans will offer benefits that you don't have with traditional Medicare. So for example, maybe a gym membership, or maybe a wellness exam, or not wellness exam, but wellness programs, or chronic care programs, especially if a person has multiple problems, dental benefits, vision benefits. These are a lot of things that Medicare, traditional Medicare doesn't cover. So your Medicare Advantage plan, remember, it's like that coordinated outfit, kind of throws in the belt and the shoes free of charge. You don't have to worry about picking all those things. So that's what most people are out there looking for in the marketplace.
So you got to get the whole ensemble.
Obviously, you should pick always the right choice for you. So for some people, the coordinated outfit works perfectly. Other ones, they want to pick and choose each piece. And so you really got to think about what's your budget, and what is your actual health costs. What kind of what kind of specialist do you need? You got to make sure if you do choose a plan, make sure that your physician that you want to stay with covers is on that plan. I always tell patients, don't take the word. Agents are great, they can help, but don't take the word of the agent, and don't necessarily just look in the directory. Many times that can be dated. I would urge people, call the office of the physician that you want to see, and make sure that they really, really take your plan. Many times you might be given misinformation, but ultimately the goal is going to be to pick the right plan for your particular health needs that's going to fit in your budget, and also going to give you the flexibility that you need.
All right, Dr. Kristi Clark, thank you so much. There's the information on your screen, healthtexas.org for more information, or call 731-HTMG. That's 731-HTMG.